Hello and good morning, everyone. This is Daryl Edwards with Aim Higher, Inc. And today we're at Comprehensive Cancer Center's Cancer Support Center. And we are here today with Dr. Christina Pozo, most wonderful doctor I've ever met with the biggest heart. And she's going to tell you today what we do at the Cancer Support Center.
Hi, thank you, Daryl, so much for doing this. So, cancer support services really encompass everything that you can think of to support the patient and the family when they get diagnosed with cancer.
Yes.
So we know that when you hear that word cancer and you get that diagnosis, you immediately have an emotional response.
Yes.
You can't separate that from the medical information. It all comes in together.
Yeah.
And so we realize we need to really help people to cope, not only when they're first diagnosed, but throughout the journey, even after treatment.
Yes.
Because end of treatment is sometimes, again, another transition point. And we know people cope in different ways. So we really have here a department that focuses on those emotional and spiritual needs.
Yes.
So we offer many of our services free to our patients, and they're always offered by specialists who are specifically trained to work with cancer patients.
Yes.
So for example, we offer free of charge for our patients when they are getting chemotherapy, a massage.
Yes.
And so that's part of their treatment here. Again, we're very careful. We hire people who understand what to do so you don't hurt somebody that's going through treatment and has cancer. We also offer free of charge for our patients music therapy.
Yeah.
We offer art therapy. We offer exercise physiology. We all know that it's important to move in general and to keep active, but how do you do that? How do you exercise when you're going through treatment or you've had treatment? We offer yoga for our patients. We offer it both inpatient and we offer classes.
Yeah. And I'm a pancreatic cancer survivor, you know, and what I was able to do, I was able to afford these services such as massage and different services that they provide. But there are individuals that can't afford these services, and that's why we're here.
Exactly.
Yes.
Well, and as you know, as a pancreatic cancer survivor, nutrition is such a critical part of the total care of the patient.
And that was quite expensive when I hired a nutritionist.
Right.
Yeah.
And so we have oncology trained dietitians who some of them were instrumental in setting up the specialty of oncology nutrition.
Yeah.
And so we have them here as part of our department. We have chaplains and spiritual counselors. We really have a total team approach.
Yeah.
Those services are all free of charge for all our patients that come through. You'll later on get to meet somebody that you'll be talking to who we even offer free wigs for our patients that come through here. We offer pet therapy because we think that's an important component for our patients and families who are like in the hospital. And then we have 3 services that we do charge for.
Yeah.
We do charge for acupuncture, but again, nominal fee if your insurance doesn't cover. And then we do bill for psychiatry and psychology. And by training, I'm a clinical psychologist. I've been doing this for over 25 years. And we realize that the needs of cancer patients and their families are different than somebody who's, going through just regular life stress. So again, our psychologists and psychiatrists are all trained to work in the field. I've been working, as I said, 25 years, but then I trained at Sloan Kettering, where again is one of the initial places where this field really developed.
And like I said, everyone, isn't she wonderful? She's wonderful, and she got into this because your mother.
Yes.
Yeah. If I can ask that, is that okay?
Yes, of course. Yeah. So when I was a young child, I was 3, 4, and 5. You're right. My mom was diagnosed with cancer. And at the time, in the 60s, there weren't that many treatments available. Cancer was often a death sentence.
Yes.
My mom did manage to go and do some research and found a surgeon who was trained to work with head and neck cancers. And she's one of those lucky people who did survive. And I was terrified as a child, with my mom going through all this and seeing what she was going through. And so the 2 things I did at the time were I prayed a lot, and then I said that if if my mom survived, I wanted to dedicate my life to working with people going through this. And so she did survive, thankfully. And so this is all I've done. And then I'm going to say one other thing that people don't usually think about. I also provide sex therapy, but
Uh-huh.
patients that are going through treatment, because that's another part that people don't think about.
Yes.
So again, those are some of the services we provide, and pretty much everybody we have has some personal connection
Yeah.
to cancer, either through family or through their own experiences. And I think that means that they bring that passion and that true, not only passion for what they're doing, but true compassion and empathy for their work.
Yeah, and everyone, I know you can hear Dr. Pozo's heart, and I am so pleased to announce our partnership and that we're going to be raising funds for Comprehensive Cancer Center, and we thank you so much for watching. And this is for you, the patients that are out there, you that are going through therapy and going through chemotherapy. We are here at the Cancer Support Center, and we're here to support you. And we thank you for watching.
Thank you.